So in order to understand the type of asthma, listen, there is only basically two type of asthma. First is your ectopic asthma, and second is your non-atopic asthma. Okay, so there is only two type of asthma: atopic asthma and ectopic asthma. Ectopic asthma, no, not, you can just like, okay, atopic asthma, and there's non-atopic asthma. Okay, so there are only two type of asthma, to be very specifically, and some people were calling like bronchial asthma. Listen, if I teach you very clearly, so um asthma happens only in your lower respiratory tract, basically in your trachea and in your bronchi. Okay, asthma basically affect your trachea and your bronchi. Make this thing very clear in your mind. Okay, these are the only two locations which is, so you can call tracheal asthma, you can call it bronchial asthma. Okay, it's just depending upon the location where it is happening. This is all. But if I talk about type, so there are only two type of asthma, which is atopic asthma and non-atopic asthma. Atopic asthma is IgE mediated. Okay, so it IgE so it like, so it is basically affected by your if a patient is have a history. So if the parents are having a child, could happen. So may mostly seen in children, atopic asthma. Okay, so they're immune mediated reacted. Okay, okay. So for they are having any kind of allergic. So they are being allergic to something. That's why this is IgE immune mediated. And the second type of asthma, which is Ig, where there is this is not IgE mediated. So in this patient, they will have IgE normal, but here you will have increase in IgE value. Okay, okay. So this might be induced due to cold weather. Okay, some people have asthma in cold weather, so there is no kind of allergen. Is not only there's a temperature decrease, and that's why your patient is having uh, asthma. Okay, so there might be a drug induced. So you know there's one special drug, which is this drug. I'm telling you now. Remember, it's for lifetime. There is drug which is called as Nasage aspirin. Aspirin induced asthma is there. Okay, aspirin induced asthma, which is not, there's no antibody present, but this, it is not immune mediated. So if the patient is having asthma due to cold weather, or if a patient is having asthma due to drug like your aspirin, so these are come under non-atopic asthma. Understood? And if I talk about atopic asthma, you should be very clear. For example, a patient is having asthma due to pollen grain. So our body consider pollen grain as a foreign particle and try to attack. In order to attack, it produces so many inflammatory mediators. So when inflammatory mediators occur in the body, there is inflammation, and there is inflammation, there is bronchoconstriction, and there is increase in secretion. So this is what your asthma is looking like. Okay, and yeah, so it can be due to infection. Okay, it could be due to drug, and here it could be due to your pollen grains. Okay, and allergic to peanut, allergic to dust. It can be any allergic reaction, or it can be due to occupational asthma. If a patient is working in a silicosis factory or biogases or sugar cane factories, they can have silicosis, they can have mica. If they are working in a construction, they can have a mica asthma due to mica. Okay, so there are different type of, or there is